Meeting to order. I call upon our secretary, K.R. Narayanan, to start the meeting. Now I call upon Narayanan to start the meeting with our prayer. Over to Narayanan, please.
Good evening. Heaven of freedom, where the mind is without fear and the head is held high, where the knowledge is free, where the world has not been broken up into fragments by narrow domestic walls, where the words come out from the depth of truth, where tireless striving stretches its arm towards perfection, where the clear stream of reason has not lost its way into the dreary deserts and of dead habit, where the mind is led forward by thee in the ever-widening thought and action, into the heaven of freedom. My Father, let my country awake.
Thank you, Narayanan. Proceeding further. Friends on same wavelength, Chennai Annanagar chapter, welcoming you all for our 73rd meet. That means we have completed 14 years, 5 months of inception by the kind cooperation of all our members. And then I take the opportunity, this has happened to be a very auspicious centenary endowment lecture of my guru as well as my mentor, late M L Swamy Garu, with his missus. You can see the photo on the screen. We are very grateful to you, sir, for having started this particular chapter and grew it into a big banyan tree with a lot of branches in it. We are very, very happy to remember you, sir, on this day. And I also take the opportunity of welcoming my fellow FOSWLians like ICC Cupertino, FOSW Hyderabad, FOSW Chennai Annanagar as well as Adyar, and FOSW Vijayawada, and my own music group members. I welcome them all for this today's endowment lecture of M L Swamy Garu. You can all see the photos of M L Swamy Garu with his missus Rachakonda. Such an ideal couple there. Kindly look at them, all of you, and enjoy and pay your own respects to them. Very, very happy about it. And I take the great pleasure of welcoming our distinguished guest, our speaker, Professor Dr. R.V.S.N. Sarma, with whom we are all very, very familiar. He happens to be our Vice President also. He is a highly qualified medical consultant, having the MSc, FCGP, FRCP, and FACP qualifications. He is like an authority in the medical subject. In addition to that, he is also very much into the philanthropy, Ramayana, Mahabharata, and scriptures. Whatever subject he takes, he delivers in a very, very implicit manner and very impressive. We are very happy that today is our distinguished speaker who could spare some time to give a lecture. The subject what he has chosen today is how to prevent dementia in the elderly. How to prevent dementia in the elderly. This is a very, very important and a useful topic, especially for our own members. I am sure many of our own members may be suffering from this. So let us all know all about this dementia from our distinguished speaker. After his lecture, it will be followed by discussion wherein he will clarify what are all the doubts we may have. You can ask him directly. He will be too happy to answer us. Now, before going into the lecture, I call upon our Joint Secretary Ananda Kumar to introduce our distinguished speaker. Over to Ananda Kumar, please.
Good evening. I hope I'm audible.
Very much.
Welcome to our founder, Sri M L Swamy Gari Memorial Lecture today, commemorating his centenary year. I just read the founder's welcome address for the 200th meet dated 8/8/2016 and forwarded the same for the pleasure of fellow members. Dear FOSWLians, it has become customary for us to have Dr. Rachakonda V.S. and Sarma Garu, our versatile vice president, to deliver our founders' endowment lecture every March. He is going to speak to us on dementia in the elderly. We have been getting welcome WhatsApp messages for this topic from all our members, which shows the eagerness and interest of our members in the speaker and also the subject. Friends, we would have come across many jacks of all trades and masters of none, but here is a man of gentle wisdom and master of all subjects he learns and teaches. This eminent Dr. CV's website, blog, or YouTube channel have no coverage on dementia. But when suggested by President Dr. Vatayam Sarmagaru, he readily obliged and is now ready with his presentation. That's our friend on same wavelength, Dr. RVS and Sarma, before you for the next 45 minutes and doubts clearance. Thank you. Over to Sarma Garu.
Thank you very much, Anand Kumar. Now I hand over the mic to our distinguished speaker of today, Professor Dr. R.V.S. Sharma. Over to R.V.S. Sharma. After his lecture, it will be followed with discussions by our members. Over to Anand Sharma Garu, please.
यस्माज्जातं जगत्सर्वं यस्मिन्नेव प्रलीयते येनेदं धार्यते चैव तस्मै ज्ञानात्मने नमः. My obeisance to the Almighty, the all-knowledgeable, who is endowing us with the power to speak and then do whatever best is possible in this life. I record here my humble pranams to my gurus, both spiritual and material, who have made me what I am today. Without their contribution in my life, I would have been a mere naught. Now, I also record my thanks to my elder brother, Dr. V.S. Sarma Garu, our president here, who is kind enough to accommodate me and permit me to give this endowment oration today. For the kind words of introduction and friendship, Anand Kumar ji, my pranams to you. Narayanan, as usual, is the important person to conduct these things. My thanks to him for arranging these things nicely. This topic has been introduced as prevention of dementia in elderly. Of course, that is tailored that way to bring in the attention of the audience. But in general, I'm going to show not only the prevention, but also something about the disease itself first, because many of us here may not be clearly having an idea what exactly is dementia. There are many doctor friends of mine and Ajjain Bharati member friends. I welcome them, and the doctor friends, please bear with me if it is too basic for you. I'm sure you'll have a point here and there to brush up your knowledge and then experience the flow of presentation. Okay, now I'm unsharing this. I'm going into another mode where I will be presenting you the Word document today for a change, and I will. What is dementia? Before that, you see in the header the www.drsharma.in and my mobile number. I welcome all of you to utilize the website and also to contact me over WhatsApp or message for any of your clarifications. What is dementia? Mentation means brain function. Dementia, decreased mentation. What are the functions of the brain? Brain has got several functions. Sensory functions, special sensory functions, eyes, ears, tongue, etc. Sensory functions like pain, touch, all those things. Plus motor functions like ability to speak, walk, do things, motor functions, memory, and then ability to understand and analyze and think, the thought process. These are all the various faculties of brain. The part of the brain, each part of the brain is allocated for one particular faculty of these functions, and they're all wired, interconnected. The central grid is the brain, and the wire connections, just like you have the central supply of your power supply in your house, and you have the various electrical gadgets, the mixie, the fan, various electrical gadgets functioning in your house through the various wires. The neurons, called the electrical nerve centers, are connected by a network of similar to electrical wires. These neurons speak to each other just as we speak to one another. And that speech is by chemicals called neurochemicals. Foremost among them is dopamine, serotonin, noradrenaline, GABA, and several others. Most importantly, for the dopamine, noradrenaline, serotonin, and GABA. The disturbance in these chemicals can lead to various brain disorders. So when two nerve endings are like this and they want to communicate, they don't actually shake hands, but there is a gap. Through the gap, the chemicals communicate from one side to the other. What happens in dementia is that space between the neuronal connections is filled with unnecessary material, and the communication between the neurons is obstructed or reduced. So much so, it results in dementia. Remember, dementia is not a psychiatric disease. Mananoyi kadeyadu. It is not related to the mind. Manasika vyadhi kadadi. It is a disease of the cognitive system of the brain. So much so, it is a structural and functional disorder of the brain proper. It's the main understanding. You may think dementia means depression or some psychological disorder. Remove that concept from the mind. The word dementia describes a set of symptoms that over a time can affect memory, problem solving, language, behavior. As brain has got manifold functions, any one of these functions or more of them may be affected. Commonly, the memory is affected. That's why dementia means we think loss of memory. But it is not restricted to just loss of memory only. It is not forgetfulness. It is not only forgetfulness. There are several other things which are disturbed in the dementia. What is the most common type of dementia disorder? Alzheimer's disease. There is one disease called Alzheimer's. For all practical purposes, we will call this hereafter as AD. AD means Alzheimer's disorder. Okay. What are the symptoms of dementia? First of all, may you know each person experiences dementia in a different ways. Just like each person expresses his mind in different ways, the dementia also is expressed in a different ways. Different types of dementia affect people differently, especially in the early stages. However, there are some common symptoms of dementia. These have to be learned. Why? I would like to know, not to assess my friend. I wanted to know whether I am having these symptoms. Dementia are a group of symptoms and caused by different diseases that damage my brain. This means what? Fever. Fever, is it a disease? Fever. Fever is a symptom. There are many entities which go into fever. Typhoid fever, malaria fever, urinary tract infection, tuberculosis, many fevers. Likewise, fever is not a diagnosis. Fever is not a disease. Fever is a symptom. Dementia is a symptom. This dementia is a basket of symptoms into which several diseases come in, just like several fevers are put in the basket of fever. Okay. Dementia is a group of symptoms caused by different diseases that damage the brain both structurally and functionally. Another most important aspect of dementia is it is progressive. It gets worse over time. Symptoms are progressive. If it is a static disease, our interest will be less. If it is progressive, we have to take care because it will progress to a complete loss of memory and then function. So it's a progressive disease. What are the many types of dementia? First and foremost is called Alzheimer's disease or AD. About 50% of the dementias are Alzheimer's disease. Next common disorder is called vascular dementia. Vascular, blood vessel. If the blood supply to the brain is reduced due to various factors, including aging, naturally the brain function will be compromised. That is called the vascular dementia. That is the next most common cause. Yes. Another thing is, I think he is an old man, he is getting aged, that is why he is forgetting. Dementia is part of a aging process, like graying hair. These are cock and bull stories. It is not part of aging. Of course, age is a contributory factor, but doesn't mean the moment you age, you will forget or you will have dementia. We know several people who are in 70s, 80s, 90s, and 100 years also. They are very sharp in their memory and in their cognitive functions. So that means what? If I am careful now, if I live 100 years, I can live without dementia. That's a very strong message you must take. No, I'm getting old. After 80 years, anyway, I'll forget everything. It's okay, but that's not generally the attitude you should take. Okay? It is caused when a disease damages the nerve cells and their communication with their sister fellow nerve cells through the chemicals. Nerve cells carry messages from different parts of the brain and different parts of the body, and as more nerve cells are damaged, the brain becomes less able to work properly. Here, you might note that we have got one important information. For example, liver, the cells regenerate very fast, intestinal cells regenerate, skin cells regenerate, every part of the body, the cells regenerate and new cells are produced. In brain, there is only one way. The number of neurons at birth are there, their only downward trend goes on going down. That means there is no new nerve cell formed in our lifetime. Means what? I should be careful to preserve the existing nerve cells because I cannot get new nerve cells, nor I can get a transplant like a heart transplant. Dementia can be caused, as I told you, by many diseases, and these diseases affect different pathways. The difference between Alzheimer's and dementia, I have already told you. Alzheimer's is a specific type of brain disease with dementia as the major cause. Just like typhoid is one type of specific type of fever among so many other fevers. Alzheimer's, AD, is a specific type of dementia with among so many other types of disorders. While dementia is what? It's a group of symptoms of various causes. Common one, of course, being Alzheimer's. What are the types of dementia? I am only talking about the common forms. 95% of the dementias fall in the following category. Number one, I told you, around 40 to 50% is Alzheimer's. Next important is called the MID or vascular dementia. Vascular dementia means related to the deterioration in the blood vessels, the vascular dementia. And this vascular dementia is called multi-infarct dementia. Sometimes when you get a report in the MRI, they will say MID or multi-infarct dementia. Infarct is blood clot. Where? In the brain. The blood clot in the brain produces brain infarction. Just like a heart infarction, myocardial infarction, you have brain infarction. If it happens in small blood vessels, in multiple places in the brain, it is called multi-infarct dementia, also simply called vascular dementia. There is another one called the LBD. Don't worry about the various medical aspects of it. Suffice to know that is another type called the Lewy body dementia. And the fourth one is the frontotemporal dementia. That is frontal lobe is the front part, temporal lobe is the side part. Probably that is why when you have something to think like that, because temporal lobe is there. And frontal lobe also, you will, hit your head, probably recollect something. So simply I'm saying that Lewy body dementia, frontotemporal dementia, this disease may be familiar to some of you, Parkinson's disease, and it has got a component called dementia, that is called Parkinson's dementia, also called PDD. And remember, there is another entity, important entity, for those who consume alcohol related dementia, also called alcohol related brain damage, ARBD. Now, I'm summarizing. What are the most important forms of dementia? AD, Alzheimer's disease, vascular dementia, that is called MID, Lewy body dementia, LBD, frontotemporal dementia, FTD, Parkinson's dementia, PDD, alcohol-related brain damage. Yeah. Why I need to know? Because the presentations are different, the investigations are different, and the treatment, of course, is different. Another way of looking at dementia is those dementias which can be reversed and cured or arrested, those which cannot be arrested. That is modifiable dementia, non-modifiable dementia. There is another classification. That is a useful functional classification of dichotomy modifiable dementia, non-modifiable dementia. So there are some rare causes of dementia which this audience need not know. They all together contribute only to 5% of the dementia. This presentation, this Word document, I'm going to share. Those who are medical people here, they can read this paragraph for themselves, and I'm not going to dilate on that because it doesn't enthuse the common non-medical person. Okay. Is dementia a disease of an aged only, or can it occur in the young also? Yes, this is called young onset dementia, YOD. Before the age of 65, somebody develops dementia, we call it as young onset dementia. One reason, important reason of amnesia and dementia is trauma. You will be seeing in several pictures. Hero had an accident, he injured his brain, he forgot his wife, or forgot his whereabouts. That is amnesia, post-traumatic amnesia, post-accident dementia also. What are the symptoms of dementia? Is it only memory loss, or are there anything else that dementia can present? However, there are some common early signs and symptoms. Memory loss, for example, problems recalling things that happened recently. For example, I asked that person, what did you eat for your breakfast day before yesterday? Most of you will be able to recall. But a person with dementia will not be able to recall it. When was your first child born? In which hospital or which city? If I ask, most of you will be able to tell, yeah, this is the city in which my first child born. But these people, they will not be able to tell. That is past event. Recent events, breakfast, past event is childbirth. Likewise, you can ask them which city you were born. Some questions like that will probe and tell whether they have a memory loss for recent events and past events. The second one is difficulty in concentrating, planning, and organizing simple tasks. So most of us will not give attention to this. Earlier, I was able to concentrate, read for 1 hour, absorb things properly, write down notes, repeat it. Now I am not able to concentrate for more than 5 minutes. Means you are already in for dementia. It's not only memory loss, it is a cognitive decline of all the functions of the brain. What are all the functions? Sensory, special sensory, motor, balance, walking, visual, hearing, memory, recall, registration, thinking, understanding, concentrating, all are brain functions. Any one of them can show a decline. Problems with language and communication will be very evident also. When you talk with the person who is dementic, he tries to find words. You want to explain, and he keeps on, he says that the word doesn't come out. He says it in the mouth, and I'm not able to bring out the exact word to explain it, and it takes time. And also, he will not, he or she will not be able to communicate in a way they were communicating earlier, their ideas. This is a difficulty in conversation and finding the right word for whatever they wanted to express. Misunderstanding what is being seen. This is a vision related dementia. That means they misjudge the distance, they misjudge the steps, they may miss the step because they don't perceive the depth, they don't perceive the distance. This is also dementia. Earlier, what you are thinking? Dementia means only forgetfulness. No, forgetfulness is one important feature of dementia. There are other things. Sometimes they will fail to perceive the edges of the object. Let's say the table is there. I know where the table ends by looking at it. I keep the pen or anything on the table properly within the boundaries of the table. These people will not mind the edge and they will drop it off the table. This is not able to perceive the edges of objects and misinterpreting patterns and reflections. And another thing, being confused about the time and place. For example, losing track of the time. If you ask them what is the time of the day and what is the day, what is the season, what is the date, you may not be able to immediately answer. They will take several minutes to come out with an answer. Or you leave them in a familiar surrounding, they will not be able to make home and they will lose their way. They will not be able to find their way home from familiar surroundings. Of course, new surroundings, you and I also will have problem. Another thing is mood changes. That means difficulty in controlling emotions. There may be outbursts of emotions, anxious, irritable, sad, frightened. Suppose the patient's daughter comes and says, "Sir, my father was never this irritable and sort of temper tantrums and all. Nowadays, I see that for simple things he's getting irritated." That is the catch. So he might be in for dementia, losing interest in things. Earlier, let us say, he's very much interested in playing cricket or sports or any music or drawing or painting. Now he says, "No, I don't want to do that." Personal appearance is not taken care of. That means they don't groom properly, they don't dress properly, they don't wash themselves daily, they don't present themselves in an appealing manner in the society. And personality changes also can occur. What did I tell? Dementia is not forgetfulness alone. Memory loss is one component, important component. Difficulty in concentrating and planning and organizing things, memory loss, problems with language and communication. Okay, problems with language and communication, and misunderstanding what is being seen, and also confused about the time and place and orientation, and mood changes, personality and appearance difficulty. With some types of dementia, the person may have difficulty in what is real and what isn't real. Most of us have that problem. What is real and what isn't real means they may see or hear things that are not really there. These are called hallucinations. That is, supposing I'm in this room, nobody is speaking. I feel that somebody is talking to me, and hallucination. Or I'm seeing some objects before my eyes, visual hallucinations. Or sometimes they strongly believe what is not true. The door is locked, but he strongly believes it is not locked. He goes on going and closing the door again and again. These are called delusions and hallucinations. These are delusions and hallucinations. Okay. Now, dementia-like symptoms can also be caused by other disorders. What are they? MCI, called mild cognitive impairment. Cognitive is brain function. Simply understand all brain functions put together, one word is cognition, cognitive brain function. Mild cognitive impairment is a condition which causes minor problems with the memory or thinking. Unlike dementia, the symptoms are not severe. Generally, they do not pose any problem. They don't progress also. These people with the MCI can manage the rest of the life. MCI is a non-progressive, minimalistic, sort of cognitive decline, which may occur due to various causes. Another thing is functional cognitive disorder called the FCD. FCD means, unlike dementia, in functional disorder, there is no brain death, there is no loss of brain cells, there is no problem structurally and functionally in the brain. They're unlikely to become worse because the brain is normal. With right support, this functional cognitive disorder will improve. What is the burden of this disease? It is estimated around 5 years back that 90 lakhs people in India, that means 1 crore people in India, are having dementia out of the 140 crores, including children, adults, everything. But when you cross 65, the proportion very much increases significantly with the age. If you ask me what is the single most important risk factor for dementia, is increasing age. Okay, now 1 in 10 people aged over 65 have dementia. You can count here. If there are 30 people aged about 65 here in this group, out of the 50, 1 in 10 means there are 5 people who are dementic in this gathering. Unless evaluated, we will not know that we are suffering from early dementia. Why require to know early dementia? It is a preventable disease. If it can arrest the progress. If you know the type of the dementia, diagnose it early, you can see the functional life can be given good functional life. And the same frequency raises to 1 in 5, or 20% of people above 80 years have dementia. You know how many people are diabetic in the community? 5%. 20% dementia, 5% diabetes, 3 to 4% hypertension, 1 to 2% hypercholesterolemia. You concentrate on those numbers and look for those things. Of course, you have to take care of them, but dementia is equally important disease. 1 in 10 about 65, 1 in 5 above 80. Another important thing is dementia is more common in the female gender. And women are more affected than men. Why do some people get dementia, some others not? This is a general oft-asked question, Why me? If I get diabetes, why me alone? Why not that person? Similarly, here also, not everyone who is 65 or 80 are getting dementia. Why some people are not getting? Why some people are getting? There must be some trick. Let me know the trick so that I can also be very careful and see I will follow my friend and not have dementia. What are the things you can follow? One important thing is the age. Age is the one important thing. Lifestyle, the type of lifestyle they are having, and associated health conditions. Age, lifestyle. Lifestyle means eating habits, exercise habits, reading habits, thinking habits. All those things put together is called one word, lifestyle. And then health conditions. Whether they have diabetes, whether they have hypertension, whether they have other comorbidities, kidney disease, heart disease, things like that. So it depends on 4 or 5 important factors. 1, age, 2, lifestyle, 3, health conditions, and of course, genes. Genes are not the most important ones. However, they contribute. There are certain familial genes which are transmitted from parents to the children. If the parents are dementic, the children will get dementic. Always we ask for the family history. Is there any family history of dementia in your father or mother or elder brother or sister? Of course, very important. Age, can I modify my age? No. Can I reduce my age? Can I change my gender? No. Can I change my genes? I cannot. Can I modify my lifestyle? Yes. Can I attend to my health conditions? Certainly, yes. So there are certain things which are in our hand. There are certain things which are not in our hand. The things which in our hand, we should take control of them. What are they? Blood pressure, physical activity, alcohol consumption, smoking. Vision impairment and hearing loss are often neglected, particularly hearing loss. For the simple reason, if somebody wears a hearing aid, they will know that I am having a hearing loss. Is it important for you to have good hearing or somebody knowing that you are having it? Let us not live for the sake of the world. Let us live for ourselves. Hearing loss should be assessed and then corrected with suitable hearing aids, just like the specs. Visual impairment also, people do not go for regular eye checkups. The same old 10-year-old lenses they keep on using. In between, there are a lot of changes in the inner parts of the eye, including the very simple thing like cataract, have to be attended to. Vision impairment and hearing loss make you less sociable. Not only you lose the function of the organ, their ability to interact with others in the community, in the family, in the society is much reduced, so much so they will be not partaking in the life fully. So that is why you have to address to. Then diet, very often questioned, are there any diet tricks which can prevent dementia? This is the trick. High carbohydrate diet, very much favorable for dementia, low protein, low fruits, low vegetables. How many, tell me here, how many of you are eating 5 servings of fruits in a day? A serving means a handful, fistful. Fistful fruits 5 times a day. Likewise, another 5 servings of cut vegetables. How many of you are eating? Question yourself. You don't have to answer. And you don't use any protein at all. If at all you use a little bit of dal in the sambar, that is a very meager amount of protein. Every one of us requires protein supplements because Indian diets are highly protein deficient and carbohydrate rich. We South Indians, our main thing is rice, rice, rice. And this is high carbohydrate. High carbohydrate today is the killer of a person due to various diseases. You reduce your carbs, increase your protein, increase your fruits, vegetables, a couple of nuts morning and evening, any type of nut also will be very useful. So what are my modifying factors? High blood pressure, physical inactivity, diabetes, goes without saying, along with the high blood pressure, diabetes mellitus also, drinking alcohol, smoking, hearing loss and visual impairment, and dietary factors. What are the common causes of memory problems other than Alzheimer's and what we have thought? Difficulty in memory can be caused due to various causes. Becoming more forgetful does not mean that they have dementia. Some people can remember things better. They can narrate their poems of their childhood. Whatever they read, immediately they'll be able to reproduce. Some others are not. That is understandable. That individual differences in intelligence, dharana, memory, repetition, recall is understandable. Given that allowance, there are the functions cognition, that is, you see a thing and understand this is bottle, this is pen, this is table, then register that and then retain that information, appropriate time, you bring it back, recall, and then recognize when it again appears in your life. Recognition is again twofold. Recognition when the object is before you, or recognition when somebody tells about the object. For example, recognition is I know a friend and he comes to my house again after 10 years. I recognize him. Recognize him. Okay. Somebody talks about Taj Mahal. I have seen some time back, 15 years back. I recognize. Now, Taj Mahal is not in front of me, but I'll still recognize that. So this is one thing is called recognition in person, recognition from the memory. Okay. Health conditions that can affect the memory are depressive illnesses, anxiety, psychiatric illnesses do have an impact on the dementia. I told you dementia is not a psychiatric illness, but psychiatric illnesses do have a very good impact on the dementia. Chest and urinary infections, hypothyroidism, menopausal changes, vitamin deficiencies, particularly B12, niacin, and thiamine B1 deficiencies are important. Long-term heart and kidney conditions, head injuries. Somebody has a head injury, trauma to the memory areas of the brain, post-traumatic amnesia. If memory loss is caused by treatable health conditions, it can improve with the right support. Other causes of memory problems, some problems can be as a result of stress. Being stressed or overwhelmed can make it harder to focus, think clearly, and learn new information. This can make it difficult to form new memories and remember them later. Then what to do? You require some stress bursters. Stress is of two types, a positive stress and a negative stress. Positive stress is the one which you enjoy doing it. Negative stress is the one which you feel you would get away from that situation. Sleep problems also are associated with 6 to 8 hours of quality sleep is essential. Ensure that you have 6 to 8 hours of quality sleep every day. Not getting enough sleep, brain function is damaged, and it will lead to dementia. Consuming alcohol, I have already told you, alcohol related brain disorder, medicinal side effects. These are another thing is sometimes, as we age, we need to take several medicines for various diseases. These medicines may have an adverse impact on cognition. Check the leaflet of the medicines, or also ask your prescribing doctor, sir, doctor, do you think that my cognitive brain function is affected by the medicine that you? Most common medicines are antihistamines, some of the cough syrups, and then some of the types of sleeping pills. Over the counter, you buy and take without doctor's advice for a prolonged period. These are the ones which are benzodiazepines, like your Compose or any other sleep-inducing drug, Zalprac. Not that you should stop them. You should know that this can lead to sort of impaired function, cognitive function. Discuss with your doctor, adjust the dose, and if necessary, continue. If not, we can withdraw them. Problems with taking information. That means someone is not remembering things well, but problem may be the way of taking the information. That means the attention is not being paid. There is eyesight problem, or there is a hearing problem. That is why he is not able to listen or see or understand the things. That's why he is not able to participate. Memory loss is a sign of dementia. Memory loss is common early sign of dementia. Okay, this is because it is caused by a disease that damage areas of the brain that involving new memory channels and remembering the old ones. So what about my life expectancy if I have dementia? Okay. It is not a life-threatening disorder. It is a life-limiting disorder. Life-threatening means heart attack. It's a life-threatening disorder. Brain stroke, life-threatening disorder. Life-limiting conditions means they will reduce the number of years that you live and also the quality of life, which is called QALY. QALY is quality of life years that we live. How many years we live? What is the quality we get? Can dementia be prevented? This is a topic that we give. Very important. Can I prevent dementia? And if I'm already demented, can I arrest it? Very much yes. An emphatic answer. Evidence shows that there are things a person can do to reduce the risk of getting dementia. Especially, you have to start early. When do I start? Between the ages of 40 and 65. Blessed are those in this group who are in that age group. Right now, you start. And those who are above 65, don't worry that you cannot become 40 now. Start those measures right now. Whatever brain function is available now, it will be preserved. You will continue to enjoy better quality of life. How do I prevent dementia? Very important question. Taking regular physical activity. There is no substitute to physical activity. Today's smoking is sitting. Don't sit idly in a chair. Don't try to find a chair. Stand and do work. And then walk. Walk in the corridor. Talk while talking phone also. Just keep walking and talk. Best thing is brisk walking, cycling, swimming if you can. Do gardening. Gardening gives two things. One, it gives the physical activity, then it gives the bondage with the plants, then you also feel you are involved, quality of life increases. A healthy weight must be maintained. Always try to 165 is your height, minus 100 is your healthy weight. So just remove that number one there. If you are 175, your ideal weight is 75. If you are 155, your ideal weight is 55. That is the rule of thumb. Then BMI, you know what is BMI? And waist circumference. Waist circumference should be less than 38 inches in men and less than 34 inches in women. This is woman and this is men. Okay. If your pant size is more than 38, sure you are in for problems. Not only dementia, many problems. Not smoking and not drinking alcohol, eating a healthy balanced diet, no carbs or less carbs, one meal a day, the other time only fruits and vegetables, particularly in the elderly. Don't try to have morning, afternoon, night, 3 meals, just like a young child who is going to school and doing a lot of work or a manual laborer. You are all a sedentary people and you don't require 3 times food, only 1 time food, that 2 times take some fruits, cut vegetables, live like a muni. This is called Vanaprastha Ashrama diet. Managing any existing health conditions, particularly diabetes, heart problems, high blood pressure, high cholesterol, in consultation with your doctor. Don't sort of tell the doctor, no, I don't want medicines, I don't want injections. What is best suitable to you? Let the doctor decide. Your target should be to keep your sugars, your blood pressures, your cholesterols on target. Don't be afraid to take medicines when properly prescribed by a competent, thoughtful physician. Treating depression very early will help. Managing any hearing loss and getting treatment, wearing proper hearing aid, keeping mentally and socially active, such as doing hobbies, adult learning, keep in touch with family and friends. And how can I? This is very important. We are not concentrating on this. So I'm again repeating these things for the sake of our friends here. Regular physical activity, there is no substitute. If something is better than mother, it is the regular physical activity. It is more important than the love of a mother. Height and weight should be very much within the adjustable, acceptable limits. BMI and waist circumference, smoking and alcohol, the two devils, drive the devils out, and then eating a healthy, balanced diet, managing existing health conditions, treating your depression if you have any depression or anxiety, attend to that, and proper treatment has to be done, and manage hearing loss and visual impairment. And I suggest all of you to try and learn a new language. Maybe Sanskrit, maybe Telugu, maybe Tamil, whichever you are already not your mother tongue. Try and learn a new language. Try and learn new skills like vocal, playing guitar, playing veena, or playing sports which are within, or board games, Sudoku, or any other things which in or your Scrabble you play, no? Scrabble, or any other mental games also. You should get engaged in that. Not injurious sports like hockey or volleyball or where you get injured, and involved in sports, non-contact sports. Hobbies should be nurtured, particularly learning new things, and always read at least 30 minutes a day In every day, 30 minutes of time you should spend in reading. 30 minutes you should spend in reading whatever that ensues you. And the best way of keeping your brain active is teach. Whatever you have learned, you teach a person who has a patient ear to listen. Okay. Now, how do I assess myself as the whether I have dementia or not? There are certain scores I will show you. One is called the MMSC, other is called MOCA, other is called ACE3. These are clinical assessments. You can yourself take those assessments. They don't require a doctor, particularly these two. ACE3 probably you may require a health professional, a nurse or a doctor. But MMSC and MOCA, I'm going to give you those handouts. You have a self-assessment and then give me the results. I even propose one more session, either in the FOSWL fold or an independent fold as a Dr. Sharma's learning group. We can meet next Sunday. If any one of you are available, give me your names to me. If a handful of people are there, I will give you a Zoom connection. Exactly similar time, 5:30. I will show you the questions. You can answer the questions online there itself with your pen, and then at the end of that you can submit. That way I know whether you require any help and intervention right now. This can be a part of FOSL meeting. Nonetheless, if FOSL frequency is once in a month, don't forget about it. I'll give you a Zoom link, and in that we can do the assessments. Second thing is complete blood count, diabetes evaluation, thyroid evaluation, cholesterols, kidney problems. Liver, this checkup must be done. Liver function, kidney function. Annual comprehensive health checkup is a must for everything. There is no way you can escape. If you do a test, people are afraid. If I do a test, then they may detect a disease. That is important for you. If disease is detected, it will be treated and damage will be prevented. If you are healthy, you will be reassured and then you will be advised preventive care. Both ways you are beneficial. It is a win-win situation. Hatova prapyasi swargam, jitvava bhokshase mahim. If you win the war, you enjoy bhoga here. If you lose the war and die, you enjoy bhoga in this swarga. It's a win-win situation. Get an annual checkup. Imaging sciences. That is taking some scans, CT, MRI, SPECT, PET, dopamine uptake. Don't go and ask the center, I am feeling I am dementic. Hey, you please do CT scan. It is not for you to ask like that. You have to consult the proper physician. The physician or the neurophysician will examine you and see which particular test will be suitable to you, whether CT or MRI or SPECT. SPECT is, single photon emission computed tomography, positron emission tomography, that is PET. There is a new studies called dopamine uptake scans for Parkinson's type of dementia. There is another beautiful investigation has come just into the clinical use, which is called the PIB, Pittsburgh Compound B amyloid imaging. It probably will replace all other imaging techniques in the next 10 years. But this is very expensive and not for us right now. So anyway, these tests are not in your realm. The treating physician will decide, and there are some genetic markers also are there, but only around 2% of the dementias are genetic. So I don't require them readily unless I have a family history. Then probably they have to identify. There are other important blood tests that are coming up for dementia, and that is your AB42 and the TAU, AB42 and TAU. What are those? In a moment's time, you will know. What are the parts of the brain affected by Alzheimer's and other dementias? This is called the forebrain. That is frontal lobe. It is called. It is just below your this part of the brain. There is another temporal lobe, just where your spets are landing. That is called the temporal lobe, which is the house of the learning and memory and all that. There is one part called the hippocampus. That is the main important area there. There is a parietal lobe, the learning lobe, the frontal, prefrontal cortex and frontal lobe, the temporal lobe, and the parietal lobe are the seeds that are affected. Early the temporal lobe, later on the frontal lobe, and finally the parietal lobe also will be affected. So you see here, a healthy brain, a normal individual, this is called white matter, this is called gray matter. The white matter and the gray matter, you see how the brain has shriveled and shrunk just like a withering leaf. That is how in severe Alzheimer's disease, there is atrophy of the brain, loss of brain mass will occur. Okay. Now, what are the treatment options? Cognitive stimulation therapy is there, and that's one form of treatment. Cognitive rehabilitation, talking therapies, and then various counselors will come and tell you how to manage the disease. Cognitive behavioral therapy, life story work. That means patient will be asked to write their life story. What happened in your teenage? What happened in your adolescence? What happened when your children were born? What happened in your job? You keep on writing. By going back into your memory, you keep on digging that, and slowly you get the memory function improving. Reminiscence work, that is, asking the dementic patients, talking about the past that they are in with, and then reminiscence means past memories. And most important, I told you, music, learning new skills, new language, creative arts therapy. These are very important. A person with dementia stays as active as possible, physically, mentally, and socially. Taking part in meaningful activities can be enjoyable and helps to increase the person's confidence and self-esteem, particularly learning a new language, playing an instrument, playing a board game, playing a non-contact sport. Any of these things will definitely help, in addition to walking, exercise, diet, alcohol, and smoking. What are the various medicines available? Of course, it is not in your realm. Just suffice to know there are medical treatments available like donepezil and rivastigmine, gelantamine, and memantine. These drugs are prescribed by the qualified specialist depending on the type of dementia you have, and then they will also address the vascular dementia. The risk factors of vascular dementia are high blood pressure and cholesterol, diabetes, and they will be addressed. A wide range of medicines can be prescribed at different times for a person with dementia, and particularly when have depression and anxiety, they have to be managed. Then dementia will also be managed. I'm going to show you a short video now.
In a person with Alzheimer's disease, toxic changes in the brain destroy healthy communication among neurons. These changes may occur years or even decades before the first clinical signs, such as memory loss. In Alzheimer's disease, researchers believe this process primarily involves two proteins, beta amyloid and tau, which build up and become toxic to brain cells. As abnormal tau accumulates, it eventually forms tangles inside neurons. Beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood, oxygen, and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons stop working properly, the brain shrinks, with early changes occurring in the hippocampus, a part of the brain important for learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons stop working properly throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, engage in meaningful activities, and live independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies to treat or prevent Alzheimer's. Much progress has been made in identifying the various factors underlying the disease. Advances in brain imaging have enabled us to see how Alzheimer's changes the living brain, even before symptoms of dementia appear. Blood and fluid biomarkers are providing insights about when the disease starts and how it affects the brain and body over time. More is also known about the genetic underpinnings of the disease and how they can affect particular biological pathways. These advances have enabled the development, testing, and availability of promising new therapies, including drugs that reduce or clear Alzheimer's-related proteins such as amyloid and tau in the brain, therapies targeting the vascular system, glucose metabolism, and inflammation, and lifestyle interventions that show promise for preventing or slowing the disease, such as increasing physical activity and exercise, managing high blood pressure, and engaging in cognitively demanding activities. Scientists continue to explore these and other behaviors that may promote brain and cognitive health, such as diet, diabetes management, and social engagement. Research continues to evolve rapidly toward effectively preventing and treating Alzheimer's disease. To learn more about Alzheimer's disease and the brain, visit alzheimers.gov.
That is the video from the National Institute of NIH Health Sciences USA. I am sharing that particular video link also in the document as well as separately. Now I'm going to show you 2 or 3 small things. You please see them. Then, for example, this one booklet I'm going to give you now right after the presentation. This booklet will be available to those who are in this group FOSWL as well as to the group where I am an important member. This booklet summarizes all information in 24 pages. And this is what is called the ACE scoring, ACE3 scoring. It's a little tough for you to administer yourself this particular scoring. This is what I will do it in the next session when we meet either next Sunday or any time you propose. Then you have this scoring. This is very simple scoring called the MMSE scoring, mini mental scale examination. For example, you see what is the year, season, date, day of the month today. I asked you. You should be able to say 2025. This is going to be summer season now, or the spring season now, whatever is the season. The date, 23rd, day, Sunday, month, March. Like that, if all the things are correct, the score is 5. Where are you are staying? That is the state, the country, the town, the floor, and the building name, or whatever it is. Like that, this is a very simple questionnaire which you can yourself administer, and then very simple, takes around 5 to 8 minutes to answer this question. Please, all of you, answer this questionnaire, and there is some sort of introduction how you answer that. Use that and use this mini mental scale or MMSE. Now, this also I am going to share with you, which is called the dementia checklist. You have to tick each of these symptoms and how frequently they are there and how they're happening. There's one related to memory and mental abilities, other related to daily activities and hearing problems and any other concerns you have. Fill this out also and then keep it for yourself. During our next session, we can see, or you can share them also if you feel they are right now very abnormal. So dementia symptoms I am sharing, MMSE I am sharing, and then ACE score I am sharing, these 3, and also dementia fact sheet, 24 pages document I am sharing. Other than that, I am also sharing you one more document, which is called MOCA document. This MOCA is a very simple pictorial type of evaluation. You can see here how do you assess your. These look very simple, but when you do them, you know that you fumble, and then you are probably already dementic. So, like you have to. This is the Montreal Cognitive Assessment, also called the MOCA. This is the latest version, and finally, it gives you a summary score whether we have dementia or not. These are screening tools which you can administer by yourself or with the help of me in the next session. What are they? So here the things are the MMSE, MOCA, that is Montreal Cognitive Ability Scoring, and ACE scoring, these three, and a fact sheet also. I am sharing with these things with you right now after the presentation, and also this document, which I prepared, the Word document, that also I will be able to share with you. Now, I will open this for questions, first with the comments by our president, followed by questions. Each one of you take turns. Don't try to open all mics at one shot. One by one, you will be able to ask the questions, fire the questions. If I know the answers, I am pleased to answer them. If I don't know, I will read them and answer for you.